My experience at Bryan has been so wonderful. I've learned so much and I've grown so much. I've had different side jobs over the years in different hospitals for various reasons, but I've always maintained my position here at Bryan, and I've gotten to do several different nursing roles. So I've gotten a breadth of a nursing background that I use in my current position. It is the forward thinking, it is the progressiveness, and it is the excellent care that they want to deliver and the hospital's values. And that's just something that I wanted to be part of.
I grew up in Northeast Nebraska. I had known of Bryan. I mean, there's a reputation. I've been able to teach students, in the classroom and on the clinical side, bridging that theory to practice. And because I have had that opportunity to be there and be on both sides, my first 7 years was working as a staff nurse on a med-surg unit. And then I went to the critical care. From there, I became a nurse manager. And now I'm at the college, and I am really fulfilling my career dream.
In September of 1968, I came to Lincoln for the first time. Then about a year later, I actually became employed by the organization. All of us, no matter what our role is here at the medical center, we do make a difference in patients. I'm not at the bedside anymore, but I have to talk to patients and families every day. And when I've had to be a patient myself, I've seen the caring, I've seen the professionalism, I've seen the knowledge of the staff, and I feel like when they've cared for me, I know they're caring for others in the same way, and it has just made me feel so good and so proud.
I've loved working for Bryan the last 10 years. The people you work with, they become like family. Because when you're working 12-hour shifts with these people, sometimes we're with them more than we're with our family. And so they do become like our family. And you go through the highs and lows with them, not so just about work, but about their life in general. And everybody is close here, and that means a lot. I can't imagine working anywhere else.
For me, 15 years of service means we get to see a lot of different things, get a lot of different experiences. Probably the memory that stands out the most for me in my history of being here at Bryan was when several of us, some nursing managers, some other HR staff, took a recruitment trip and went to the Philippines. We spent 4 or 5 days there interviewing Filipino nurses, deciding whether to make offers to them or not. And while it was a lot of work, it was also a lot of fun. And it was an experience that I'll probably maybe never get to have again.
Bryan's a great organization. I think they have treated their employees well. The job itself, my coworkers and managers, everybody looks out for one another and takes care of one another, and if you need time off, we cover for each other, and I love the variety. No day is the same, and it never gets boring.
I had the opportunity to come back to actually my home state. It was kind of a dream come true for me. Even though I'm not one providing bedside care or having that direct contact with the patient, as being a leader in this organization, we've helped develop those policies and put processes into place to help people be successful. When I look at our quality scores as an organization, I look at those outcomes, I look at our service scores, I'm watching our patient satisfaction, our employee engagement go up, our physician engagement go up. It's not just words on a wall or words on a piece of paper. People do believe in what we're doing each and every day.